So we're going to talk about the cardiovascular system. This is one specifically we're going to be working dealing with the heart. So we kind of want to talk about the circulatory system, how that flows, the anatomy, how the heart is organized. We're going to start talking a little bit about heartbeat, heart dynamics. So again, a good review. Um, Again, as far as the beating numbers, I'm not too worried about here. But basically, this throws through a series of vessels that come in through the heart. And that's where we really want to focus on is the anatomy of here. And then working of the circulatory system of the body, as well as the heart being the pump, and then working with the lungs and the respiratory aspect. So here, if we're kind of looking in where that capillary system comes through and looking at that system, here we are basically out in the peripheral section. This is taking blood out to the limbs, the trunks, everything else here, and getting exchange and bringing it back, as well as up the carotid arteries up into the brain and back down, and then out into the lungs. So that's our flow, and then our heart being the main pump that's going to circulate everything through and how that process is going to go. So we've got to start off with the heart and where it gets the deoxygenated blood to the oxygenated blood. So where this basically starts in is the vena cava dropping off deoxygenated blood right into the right atrium. So that basically comes in. It comes in through the body. The vena cava is bringing in blood into that area, deoxygenated. The right atria will contract. It'll go down into the right ventricle. Right ventricle contracts, brings it up into the pulmonary artery, which takes it out to the lungs. Out in the lungs, that's basically where it will go out and get into the capillaries and taken out into those areas where in the capillaries, that's where these are small, thin-walled vessels, and the nutrients basically are passed back and forth, dissolved gases and waste products. So that's where all the exchange happens. This happens out in the peripheral as well as in the respiratory tract as well. So again, looking at this heart, we got the four chambers, and there's basically the atria beating together and the ventricles beating together. Here's that vena cava coming in, the superior and the inferior vena cava, bringing deoxygenated blood into the right atrium. Right atrium is a small compartment. It goes into the right ventricle, much larger, more muscular because it's got to pump harder, right up into the pulmonary artery, which will then branch out and go to the left and the right pulmonary artery to each of the lungs. And we can talk about the atria. So here's basically where the heart sits in here. I kind of talked to this before when we were talking respiratory, but it's centrally located between the mediastinum and then partially off to the left side. So 3 lobes in the right lung, 2 lobes in the left, and the heart sits centrally and a little bit off-center to the left. Looking at the heart is surrounded with a layer as everyone else is. So we have what's called our pericardium. This lines the pericardial cavity. So if we're looking out here, you can see the pericardial cavity is basically where this heart is going to be sitting in. And then we have the pericardium, which is going to be lining this membrane, basically lining across that sac. When we have the pericardial sac, basically that's kind of the cavity too. This is what surrounds the heart and basically helps it stabilized into that position. So it holds it, keeps it from moving back and forth, and it's a combination of fibrous and connective tissues, a little epithelial around there, and that's basically maintains that heart in the position. And you can see it's got some fibrous attachments that is holding this portion around the area. So the pericardial sac, again, that area holding the heart into place. Now when we look over here and we're looking basically to the anatomy of the heart itself, we have the right atrium, left atrium, right ventricle, and left ventricle. These are the most muscular portion of it too here. And then we have the coronary sulcus, or basically what divides up the heart, and that's kind of where this layer of fat basically will come. And that pretty much layer of fat divides the atrium from the ventricles, And then it kind of goes down along the septum as well, dividing the right ventricle to the left ventricle. When we look at the surface and we're looking at from posterior aspect, you can see this fatty layer is surrounding the heart in all areas, kind of breaking up the different chambers. And you can see where everything comes, and you got this posterior sulcus as well. And we'll talk about the coronary supply to that as well later. So when we look at the heart wall, basically, as with everything, there's three layers. There's the epicardium, or the visceral layer. It's what basically interacts with the pericardial sac. It's that most outer layer of the heart. The myocardium is the thickest portion, which is the muscular portion, all cardiac muscle. And the endocardium is more of an epithelial type layer that lines the inside, and this is what the blood products and everything comes into. So when we look at the three locations, epi usually means out, the most exterior. Epicardium, myocardium, the muscular, and endo is the interior. And I kind of talked about each of those. So, not going to get so much in desmosomes, but basically when we're looking into the heart itself, we have the different valves, and those will be something I want you to be aware of as well too. So on the right side, between the atrioventricular area is the tricuspid valve, and on the left side is the bicuspid valve. So what's the big difference between those? Well, you got tri, so you got three folds coming in versus you have two folds. Again, another easy way to do this, on the right side, how many lobes are there in the lung? There's three, so it's the tricuspid, there's three valves. On the left side, there's two lobes of the lung, so there's two valves on the left side. Easy way to kind of remember that. And then when we look in the cut open of the heart, we see this right atrioventricular valve, which again, on this one here happens to be showing the left atrium. It's funny that we're talking about the right atrium here and referring to the left here. But on this right atrial, which is the tricuspid, here in this picture we're showing the left, we have what's called chordae tendineae. And chordae tendineae are the connective tissue fibers that grasp each of those cusps of the valve. And basically the muscles, we call them papillary muscles, those will pull down on this chordae tendineae. You can see here the muscle is relaxed and the tendons come up, allows that valve to close. When the muscle contracts, as in this one, it pulls on those chordae tendineae, which pulls on that valve and opens it up. And that's where we allow the exchange when we're getting pushed through on there. And again, here's that, again, showing that muscle contracted and that chordae tendineae is coming down, being pulled here, and then we're allowing blood to flow from the left atrium down. So the right ventricle, again, we kind of talked about that. So if we looked on this side and we're looking at heart again, that right ventricle right here and the left ventricle here. Both of them are going to be very muscular, but you can see the left ventricle is actually more muscular than the right. And again, it goes by function of it. What does the right ventricle pump blood to? Well, it pumps to the lung. It doesn't take a lot to push up through that area and get to those areas, where the left ventricle is pumping out to the entire body. So it has to be a lot thicker, and it's a more muscular aspect on the left side. Goes through a lot more stress as well. So it's kind of some big differences between the right and the left when we're dealing with squeeze, and you can see that left takes 6 to 7 times more force because we're pushing through the entire body as opposed to just pushing up into the lungs themselves. So the heart has got to work continuously, and basically not only is it pumping blood out, but it's pumping blood to itself. So it feeds itself through the arteries. So the right and left coronary arteries are the main aspect. They come right off the base of the aorta. And that's because the heart's got to feed itself first so it can make sure it can keep pumping, so it can pump out to the body and the brain, which the brain is our second most high priority area. So now we take a look at the heart, and here we're taking a look at the anterior aspect. Here we're looking at the posterior aspect of the heart. So first one we're going to look at is the right coronary artery. So the right coronary artery is going to come off the right side of the aortic arch. basically comes off right here, the base by the right atrium. So here's the right atrium here on the posterior side, and you've got the right coronary artery, which will come down, and it's going to come right down this area. This is kind of hitting the lateral wall of the right ventricle. And here, if you look on here, it's got the right ventricle. And then it's also going to descend and come down this posterior aspect along the septal ridge. But it really feeds the lateral aspect and the posterior septal aspect of the right ventricle. There's two branches off the right coronary branch. There's the marginal branch, which this marginal branch basically feeds the lateral aspect of the right atrium. And then there's the posterior branch, which comes down the septal region on the posterior aspect. The left coronary artery, this is basically majority of the supply, and this is the artery we're very dependent upon because it feeds the left side. So it supplies the left atrium, the intraventicular septum, and the left ventricle. So here we can see where it comes off of the aorta, again right at the base, pops over. We've got it descending down the septal region, comes across also feeding the anterior region of the heart and around the back. So here we'll take a look at it. So we've got two branches of it as well. We have the anterior or anterior descending branch, which comes down the septum and feeds the anterior and the septal region. So again, we see blockages in this. When we start looking at 12 leads, we'll know basically where we're seeing the blocks. If we're seeing it in V2, V3, V4, we know our block is probably going to be involving the anterior or descending branch of the left coronary artery. We also have the circumflex branch, which the circumflex comes around, does the posterior aspect, and comes down here. So we see a blockage of this. We're going to see right-sided changes, and we see blockage of the right coronary artery. We're normally going to see inferior changes as well. So inferior and lateral changes when you see the right coronary blocked. So knowing this anatomy, you're going to know where some blockage is going to occur when we're looking at 12 leads and figuring those areas out. I'm not going to go over anastomosis right now, nor am I going to go over the other great veins. Those are basically the main ones that I really wanted you to go over, is the right coronary, left coronary, and the branches. So anytime that we get an infarct to the blood supply to the heart, this is going to cause an area of dead tissue. It's like losing blood supply to the brain or the heart. Gets dead tissue, opens this penumbra, get basically an infarct to the area. The tissue starts to die. So this is what we call myocardial infarction, or basically death of the myocardial muscle. So anytime we do this, we now to make sure we can basically get that opened up, and we can read through a 12-lead EKG and find out exactly where those areas are going to do. When we're looking at the contractile cells, or basically how the heartbeat goes, this is a specialized muscle for the cardiac area, and it's the same thing. We get an action potential that flows, and it causes a contraction. And that's our normal skeletal muscle. Where with our cardiac muscle, we get an action potential, and then we'll get a contraction that's in a coordinated motion that flows through. And we'll talk about that more when we start getting into cardiac cycle, of how that goes and how that contracts, and how the beat goes down through the different fibers. But basically, we get an action potential, starts in the atrium, then we get a full contraction of the entire atrium pushing downward. That contraction hits the sinoatrial node, goes down through the Purkinje fiber, so it goes from the base of the heart and then pushes up and pumps up, so it pumps out of the arteries, out into the, basically into the body or into the lungs, depending on where we're going. So a rapid depolarization, that plateau that comes of getting out with that function, and we get it to basically a repolarize, open up the channels again, we clear out the calcium, clear out the potassium, gets ready to go again, and that's our refractory period, and then it's ready to contract again. So again, with our rapid depolarization, it's sodium that enters across the barrier. Once that comes in, and that sarcoplasmic reticulums that still surround